Distinguished delegates, Penal Reform International welcomes the opportunity to contribute to this thematic discussion. A dominant supply reduction measure employed has been to criminalise and imprison people for drug-related offences, on the erroneous assumption that this will deter people from engaging in illicit drug activities. This has resulted in law enforcement targeting those at the lowest levels of the drug chain, such as couriers, low-level dealers, farmers, and people who use drugs. This approach has led to an increase in drug-related violence, corruption, mass incarceration, and prison overcrowding, while patterns of drug production, trafficking, and consumption have tended to evolve in order to evade law enforcement actions. Punitive sentencing practices like mandatory sentencing have led to excessive prison levels, bringing a multitude of negative impacts on millions of people, with criminal justice systems remaining overloaded. It's been estimated that amongst the approximately 10 million people in prison globally, at least 1 million are there for drug-related offences, with many lengthy sentences including life imprisonment. This has contributed to what the UNODC have described as a global prison overcrowding crisis. UN data shows that 83% of drug offences are possession offences. Such minor offences are sometimes punished with harsher penalties than even for murder or rape. This raises concerns in terms of undermining both the notion of proportionality and of fairness of the law. The death penalty for drug offences in particular, applicable in 33 countries' legislation, is an ineffective deterrent and a violation of international law, as drug-related offences do not meet the threshold of being the most serious offence. The dire consequences of supply-demand reduction measures on women should not be forgotten. Punitive drug policies have been identified as one leading cause for the growing population of female prisoners. Policies fail to take into account the complex and unique pathways that women involved in criminal justice systems, including violence and economic disempowerment. The use of prison as a default sanction with drug-related offences is ineffective. Research shows that punishment has a limited impact upon reducing illicit drug use, with countries which impose severe penalties for possession and personal consumption of drugs no more likely to deter drug use in the community than countries imposing less severe sanctions. Economically, it makes no sense either. Alternatives to imprisonment provide more effective and less costly ways to reduce drug-related crime than prison. Non-custodial alternatives also promote the health and social inclusion of low-level drug offenders by addressing some of the root causes of their involvement. The criminalisation and imprisonment of drug users, coupled with opposition to proven evidence-based harm reduction services, has resulted in serious health consequences of people in prison and their communities. Without adequate education, healthcare, or harm reduction for people in prison, the transmission of infections such as HIV, hepatitis, and TB are all the more prevalent in prison than in the community. Distinguished delegates, Penal Reform International recommends the following actions are taken urgently to implement the UNGAS outcome document commitments. 1. Review existing sentencing frameworks for drug offences to ensure proportionality of sentencing, which differentiates between personal use and intent to supply via indicative quantity thresholds, as well as an assessment of all evidence available on a case-by-case basis. Ensure that sentences include the consideration of mitigating and aggravating factors, always giving preference to alternatives to imprisonment. 2. Eliminate mandatory minimum penalties and only use pre-trial detention as a last resort and where the case is accused of the most serious offence. 3. Abolish the death penalty for drug offences. 4. Address the gender disparities in sentencing policies and provide for gender-sensitive non-custodial alternatives, taking account of previous victimisation and circumstances in line with the UN Bangkok rules. 5. Finally, provide adequate healthcare and harm reduction programs for drug users in prison for the prevention, care and treatment of diseases. Ensure gender equality and access to such programs. Thank you.